I'm John Kenlon, Senior Vice President at Ensemble IQ and publisher of Drugstore News. Walgreens continues to break the mold of the corner drugstore as it transforms itself into a healthcare destination. Over 30 million COVID vaccinations, medication therapy management programs, chronic care programs, testing, and recently the addition of Village MD in Florida, Indiana, and Texas. It's an exciting transformation, and today we're here to talk about specialty pharmacy and the unique challenges and opportunities that Walgreens faces. Special welcome to Alexandra Broadus, who is the Senior Director, Specialty Health Solutions at Walgreens. Hi, Alexandra. Are you ready to get started?
Yeah, absolutely, John. Thanks so much for the opportunity.
Oh, you're welcome. So, Walgreens is no stranger to specialty pharmacy. Talk a little bit about how it began and how it's evolved over the years and why it's important to Walgreens to offer specialty services.
Yeah, absolutely. Well, we at Walgreens are really proud because we have really been a part of providing specialty pharmacy care for our communities since specialty really first entered the scene. Our first community-based specialty pharmacy location was actually servicing patients in 1995 and focused in on the HIV positive community. And since then, we've had a ton of organic growth, but we've also made several strategic investments and acquisitions, including some of the ones that people are familiar with are MedMark, Schrafts, BioScript, and many others. And also have really strong and robust partnerships with health systems throughout the country, as well as you mentioned, Village MD. And the reason why that is so critical is because we really do believe that in order to be able to care for patients in America, we have to be able to provide holistic care for them across all of their needs and their entire journey. And that begins at diagnosis, moves to when patients have changes in therapy and start on more complex therapies, and then ongoing care after they've had treatment. And so we feel really strongly that specialty will continue to be a focus for us as well as for the U.S. And in order for us to be the Pharmacy America Trust, we really need to have a strong specialty solution. In fact, you probably might know this, but in 2020, specialty drug spend in the U.S. actually overtook traditional drug spend for the first time.
Yes, I did. I do know that, and I'm fascinated by the opportunity for retail pharmacy. I think we learned from COVID that more demands are being placed on the stores, and they seem to be coming through with flying colors. Let's talk about some of the initiatives. Talk about some of the initiatives, some of the services that have launched in the last year or so, including those related to chronic diseases and any alliances or acquisitions that Walgreens has formed with other health organizations.
Yeah, sure. The last year or so has definitely been interesting and unprecedented for all of us. In the midst of all of the obstacles that whether it was the COVID pandemic or severe weather or other national events have posed, we've really had three key priorities. Our first was using our national footprint to help our patients and providers in communities take care of people with specialty conditions through all of this. And we are really incredibly proud, and I would be remiss if I didn't mention all of the great work that our over 300 community specialized locations have done to allow us to nimbly react to all of the things that have happened in the last year or so and ensure our patients never miss a day of therapy. Even this past week, our team members have been responding to Hurricane Ida and doing all that they can to help service not just our patients, but other patients who are impacted. We hear incredible stories of how our community pharmacists helped support patients with specialty conditions all the time. But one of my favorites was if you're from the Northeast or know anybody in the Northeast, you'll know that this past winter there was a really severe snowstorm that left many parts of the Northeast under several feet of snow. And we actually had a pharmacist who, because shipments were extremely delayed through carriers, drove in the midst of that snowstorm to get a patient their CF medication or cystic fibrosis medication for their child, so that patient would never miss a day of therapy. And that really speaks to what Walgreens does and why it's so important to have a specialty pharmacy and specialty pharmacist closely knit with the community. Second, I would say our next priority has really been focusing on creating access points to preventative screenings and services. You mentioned the great work our team members are doing with COVID, with over 30 million vaccines administered. Hooray. I always tell the team, thank you for literally helping to save the world. But we've also done really incredible work with health testing, with COVID testing available at over 6,000 locations nationwide. And we're taking those learnings and figuring out how can we be a better service to our community. And HIV testing is a great example of that. We've historically done incredible work with Greater Than AIDS for HIV testing on National HIV Testing Day. But when COVID hit, we knew we had to change our approach. And so we did, and we offered at-home HIV tests rather in 2020 and 2021 for over 200 community-based organizations, and have really exciting plans for 22 and 2023 to further improve accessibility to HIV testing and screenings. And we've also done really great work with the U.S. Department of Health and Human Services to raise awareness of Ready, Set, Prep nationwide this spring as things started to open up and patients started to really re-engage with the community. So very proud of that work, and it is a huge priority to us to create those access points to preventative screenings and services. And third, sorry, John, I'll let you go ahead.
Go ahead.
Third would be, we have spent quite a bit of time the last year or so actually investing in our key enablers for our specialty strategy. So we have URAC accreditation enterprise-wide, and we've also rolled out our new clinical platform, but we've made a significant investment in our technology stack as an organization and mass personalization. And I can't get into the specifics right now, but what I can share is that we have a very exciting product roadmap that's going to allow us to really deepen our relationships with patients in exciting new ways and do the work that I personally am most excited about, which is improving health outcomes.
So when I interrupted you just a few seconds ago, I was going to say, I love those healthcare hero stories. And it's why I suppose, the trust factor amongst consumers for their pharmacists is so high. Whenever you see those studies, pharmacist always is at the top of the list.
Yeah.
And if you think about it, with specialty pharmacy, which is so demanding and so special, the relationship needs to be even stronger and closer. I know how it is with my family. When we go down to pick up a prescription, we don't just pick it up. We pick it up and we talk to the pharmacist. So with specialty pharmacy, that's only going to become more important. And everything indicates that.
Yeah, completely agree. And I think that there is something really magic and special about a patient with specialty conditions who oftentimes are some of our most complex patients, being able to pick up the phone and talk to their pharmacist at their local Walgreens in the community that has the specialized training and support and resources to provide them the same level of and quality of care that they would get at any other specialty pharmacy. But it's their Walgreens pharmacist. So they are our healthcare heroes. You're 100% right.
Yes. So moving on to the next question. I think that being proficient at specialty pharmacy prepared Walgreens, as well as some of the other pharmacy retailers, for COVID because of the refrigeration aspects and all the special handling that had to be done. But what was the impact of COVID on specialty pharmacy?
Yeah, That's a great question. I think we've all learned a lot from COVID in general, and certainly we have here at Walgreens. I mentioned that we're getting a lot of learnings, both from our pharmacists providing the over 30 million COVID vaccines, as well as the over 6,000 health testing locations. So definitely learning a lot about how we can expand the role our pharmacists play in serving their communities. But also, we definitely saw the impact from COVID almost immediately and what that impact was on our patients. A really pertinent example of that is for patients who are undergoing fertility treatments, which oftentimes are very expensive, paid out of pocket, and fertility clinics had completely closed down for several months. And so we saw that immediately and tried to support our patients as best as they could when going through that journey and setback. And fortunately, in that instance, the business has certainly rebounded and patients are getting the care that they need. But we've also seen, as you guys may be aware, there was a decrease in HIV screenings, which is why it was so important for us to find a solution for National HIV Testing Day in the midst of the pandemic. And we've also seen a decrease in screenings and preventative care for oncology, whether that's colon cancer or breast cancer screening. So we've done a lot of great work with our Global Cancer Consortium and our partners Komen and LLS to try and improve accessibility to screenings. And even our partners through our Find Care app with our colon cancer screenings. So starting to see that correct itself, certainly, but it's been very well documented and it will certainly have an impact on patients throughout the US for years to come.
Yeah, I thought it was very telling that during the height of COVID, when so many other healthcare destinations were closed or weren't being visited, retail pharmacy, Walgreens figured out a way to stay open. And I think that bodes well for the future. I think our industry proved itself, which leads me to my next question. Any final thoughts on the future of specialty and what should we be looking for?
Yeah, for sure. So, I'm often asked that question, what does the future of specialty pharmacy look like? And I actually like to turn it around on its head a little bit, because I would say it's really more a question about what is the future of pharmacy. And I tell my team all the time, the future is now. Years back, we heard about personalized medicine or precision medicine. We heard about biologics. We heard about cell and gene therapy and CRISPR. And now those therapies are here. And that's really going to revolutionize the way that we provide care for our patients. And so what we need to think about is, how does that impact pharmacy as a whole? How does that impact how and where we need to care for our patients? And I personally believe that looking forward to how we will practice specialty pharmacy in the future, it becomes less about the very siloed and bifurcated experience that exists today, where patients are filling a specialty medication one place and filling all of their other medications someplace else. And it becomes more about how you take care of that patient as a whole and help manage their overall health outcomes. A great example of this is chronic inflammatory conditions. It's on the minds of all the employers and payers out there. And patients oftentimes with chronic inflammatory conditions start on very low-cost medications. So how can we help those patients be adherent to those medications, understand the importance of that therapy, help them on their journey, and when appropriate, where appropriate, get them started on a different therapy to help meet their goals. And that overarching care and holistic care for patients is where I think we'll really win in the specialty pharmacy space, but also just in pharmacy overall.
Yeah, convenient, accessible, affordable, efficient. Those are all the things that I think Walgreens is doing on behalf of their patient, helping to drive down costs, I think, for the payers and as well as the patients. So everybody wins. Mm-hmm. Alexandra Broadus, Senior Director, Specialty Health Solutions at Walgreens. Thank you so much for being here. Perhaps we can do it again.
Yes, would love that, John. Thanks so much for having me.
You're welcome.